Your Excellency, Mr. President of Faso, it should be recalled and emphasized that this high-level specialized care health infrastructure is, in fact, a direct and tangible materialization of your visionary and forward-thinking approach for a new Burkina Faso, particularly in the health sector.
For decades, advanced medical care in Burkina Faso has meant one thing for many families: leaving the country. When strokes, cancer, severe trauma, or heart disease struck, local hospitals could stabilize, but the real treatment often lay across borders. That reality is now being challenged. Near Bobo Dioulasso, in the village of Pala along National Road No. 1, Burkina Faso has completed a project unlike anything it has built before, a massive university hospital designed to handle the most complex cases at home. It is called the Centre Hospitalier Universitaire de Pala. Built to serve the entire western region and beyond, it promises intensive care, advanced imaging, cancer treatment, and the training of future doctors under one roof. But this is not just another hospital opening. This is a turning point. And as its lights rise from the red soil of Pala, one question hangs in the air. What exactly has Burkina Faso built? And why does it matter for all of West Africa?
Across much of Africa, discussions about health care are often framed by shortages of hospitals, equipment, trained professionals, and funding. For decades, the narrative has focused on what is lacking rather than what is being built. But a recent hospital inauguration in Burkina Faso has challenged that familiar storyline and ignited conversations far beyond the country as borders. The opening of a major healthcare facility under the leadership of Captain Ibrahim Traoré has captured attention across the continent. Images of the hospital, its equipment, and the scale of the project spread quickly on social media, drawing praise from supporters and curiosity from observers. For many Africans, the moment symbolized something deeper than a single building. It represented dignity, self-determination, and the possibility of a different future. To understand why this inauguration resonated so strongly, it is necessary to examine the broader context. Burkina Faso's recent history, Africa's healthcare challenges, and the powerful symbolism attached to infrastructure projects led by African governments themselves. Burkina Faso has faced profound instability in recent years. Armed insurgencies, political upheaval, and economic strain have tested the resilience of the state and its people. Access to basic services, including health care, has been severely affected, particularly in rural areas where insecurity has displaced communities and strained already limited resources. Hospitals in many parts of the country have struggled with shortages of staff, medicine, and equipment. For ordinary citizens, seeking medical care often meant traveling long distances, incurring costs they could ill afford, or relying on under-resourced facilities. Against this backdrop, the inauguration of a modern hospital carried weight far beyond its walls. Captain Ibrahim Traoré came to power in 2022 amid growing frustration over insecurity and governance. As Africa's youngest head of state, his leadership has been closely scrutinized both domestically and internationally. Supporters see him as a symbol of generational change and assertive sovereignty. Critics question the durability of military-led governments and the long-term implications for democratic governance. The hospital project has become one of the most visible initiatives associated with his leadership. At the inauguration ceremony, officials highlighted the hospital's capacity, its modern equipment, and its role in improving access to specialized medical care. Health professionals spoke about the difference such a facility could make, particularly for patients who previously had to seek treatment abroad or go without care altogether. For many observers, the significance lay not only in the hospital itself, but in what it represented. Across Africa, healthcare has long been shaped by dependence on external funding, international NGOs, and foreign aid. While these partnerships have saved lives, they have also contributed to a perception that African states are unable to provide essential services independently. The image of an African government inaugurating a major hospital using national resources challenged that perception. Social media reactions reflected this sentiment. Commentators described the moment as long overdue and inspiring. Others framed it as evidence that African leadership, when focused on public welfare, could deliver tangible results. The phrase "Africa finally gets what it deserves" began circulating online, not as a claim that all problems had been solved, but as an expression of collective pride. Healthcare experts caution against oversimplification. One hospital, however modern, cannot resolve systemic challenges. Issues such as workforce training, supply chains, maintenance, and equitable access remain critical. Yet symbolism matters, particularly in regions where citizens have grown accustomed to seeing public projects stall or fail. In that sense, the inauguration carried psychological as well as practical significance. It also reignited broader conversations about development priorities. For decades, African governments have been urged to liberalize economies, reduce public spending, and rely on private sector solutions. Critics argue that such policies often left essential services underfunded. The hospital project has been cited by supporters as evidence that direct public investment in healthcare remains not only necessary but transformative. International reaction has been mixed but attentive. Some foreign analysts view the project as a positive step toward strengthening public health systems in the Sahel, a region facing compounded crises of insecurity and climate stress. Others emphasize the need for transparency, sustainability, and integration into broader national health strategies. What is clear is that the project has shifted the conversation. In neighboring countries, commentators have drawn comparisons, asking why similar investments are not more common. Youth activists and civil society groups have pointed to the hospital as proof that leadership choices matter, that priorities shape outcomes. In Burkina Faso itself, the mood around the inauguration reflected cautious optimism. Patients and families interviewed by local media expressed hope that the new facility would reduce suffering and save lives. Medical staff spoke of professional pride and the opportunity to work with improved resources. At the same time, many acknowledged the scale of the challenges ahead. Security concerns remain acute in parts of the country. Health facilities have been targeted in conflict zones, and ensuring the safety of staff and patients is an ongoing struggle. Economic constraints also persist, limiting the state's ability to replicate such projects nationwide. Still, the hospital has become a reference point, a visible reminder that progress is possible even under difficult conditions. Beyond Burkina Faso, the inauguration tapped into a wider continental mood. Africa's population is young, increasingly connected, and impatient with narratives of perpetual crisis. Across the continent, there is growing demand for leadership that delivers visible improvements in daily life. Infrastructure projects, roads, power plants, schools, hospitals carry symbolic weight because they are tangible and relatable. A hospital, in particular, speaks to universal human concerns, health, dignity, and the right to care. The reaction to Traoré's hospital reflects this broader yearning. It is less about one leader and more about what Africans want to see replicated: accountable governance, public investment, and results that can be seen and felt. Critics urge caution, warning against personalizing development achievements. They argue that sustainable progress requires institutions, not individuals. Hospitals must be embedded within resilient systems supported by policy continuity beyond any single administration. That debate is healthy, analysts say, and reflects a maturing political conversation. What cannot be ignored is the emotional response the inauguration provoked. Images of modern wards, advanced equipment, and a confident African leadership figure standing at the center of the project resonated deeply. They contrasted sharply with decades of imagery portraying African health care as chronically dependent and overwhelmed. For the African diaspora, the moment carried particular significance. Many who have left the continent in search of better health care and opportunities expressed pride and cautious hope. Could this be the beginning of a shift that makes staying or returning more viable? The hospital's inauguration also intersects with broader geopolitical dynamics. In recent years, several African countries have sought to redefine their relationships with external partners, emphasizing sovereignty and self-reliance. Public investments in healthcare and infrastructure are often presented as part of that repositioning. Whether these ambitions can be sustained remains an open question. Funding, governance, and regional stability will all play decisive roles. For now, the hospital stands as both a functional medical facility and a powerful symbol. It symbolizes what many Africans feel has long been missing: visible commitment to public welfare. It also symbolizes the expectations now placed on leaders that rhetoric must translate into concrete action. As the initial excitement settles, attention will turn to implementation. How will the hospital be staffed? How will services be financed? Will access be equitable? Will similar projects follow? These questions will determine whether the inauguration marks a turning point or remains an isolated achievement. But one thing is clear: the moment has already altered the narrative. For once, Africa's healthcare story is not being told solely through the lens of crisis, but through the lens of possibility. And that, many believe, is why the continent is watching so closely.